Hello, and welcome to Medicare Fraud 101, an educational offering by the State Health Insurance Assistance Program. The State Health Insurance Assistance Programs, known as SHIP, provide local, in-depth, and objective insurance counseling and assistance to Medicare-eligible individuals, their families, and caregivers. The national SHIP mission is to empower, educate, and assist Medicare-eligible individuals, their families, and caregivers through objective outreach, counseling, and training to make informed health decisions that optimize access to care and benefits. In this presentation, you will learn about national Medicare scams and learn how fraud can harm the program, beneficiaries, and taxpayers. We will discuss national healthcare fraud schemes, including fraud in outpatient and inpatient settings, Medicare Part C, and prescription drug scams in Medicare Part D. You will learn about specialty issues such as medical identity theft, criminal enterprises, and the methods of contact criminals frequently use to target Medicare beneficiaries. We'll additionally discuss emerging trends and end with how to prevent, detect, and report healthcare fraud. Why is it important to be familiar with Medicare fraud schemes? Although fraud may only be a small part of the U.S. healthcare system, the financial losses and personal distress can be substantial. Identifying and reporting Medicare fraud assists in maintaining the integrity of the program. It helps to ensure the program uses its financial resources to cover needed healthcare services and supplies. Addressing fraud can also prevent financial and physical patient harm. Let's take a closer look at common types of Medicare fraud seen on a national basis. Let's begin by discussing fraud in services covered under Medicare Part B, primarily outpatient services. Fraud often occurs in areas that are critical needs for medical beneficiaries, such as home health, laboratory, office visits, durable medical equipment, and medical transportation. Home health services are an important benefit for those aging in place. Unfortunately, seniors may be more vulnerable at home as opposed to a healthcare setting, and criminals know this. One example of home health fraud is false certification of a beneficiary's homebound status to qualify for home health. Other fraudulent home health agencies may misrepresent and bill for uncovered services, such as housekeeping, routine transportation, and even adult daycare. Some beneficiaries report that Medicare was billed for home health visits that never occurred. Finally, corrupt home health company owners or marketers may provide a kickback to physicians for home health referrals, or may offer a beneficiary or family member an illegal kickback to enroll. Laboratory and other diagnostic tests are essential items in a physician's toolbox. Some laboratory services may be fraudulently unbundled from a group of tests and billed for as separate services to receive higher reimbursement. Medically unnecessary laboratory tests are also a concern. Patients may be convinced to receive unnecessary diagnostic and radiology tests, such as genetic tests. Criminal groups may pay kickbacks to providers and even patients for diagnostic tests that were not needed or never provided, such as urine drug screens. One of the most common medical services is the basic provision of an office visit, whether in person or virtually through telemedicine. Fraud can occur with office visits by billing for a higher service than was actually rendered. Providers may also scam Medicare by billing for a more expensive procedure than actually provided. One example would be to bill for a costly facet joint injection when a less expensive trigger point injection was given. Although a much needed medical service, durable medical equipment, known as DME, is a long-standing category of fraud. DME schemes often include medically necessary equipment, such as back braces, CPAP machines, and nutrition supplies, and even adult incontinence products. Fraudulent DME companies have been known to upcode by charging for power or custom wheelchairs when only a standard wheelchair was needed or provided. Kickbacks may be paid to providers to refer patients for items for things such as therapeutic mattresses, orthotics, and oxygen. Sadly, beneficiaries may also be willing participants in a scam if they accept a bribe for DME, such as selling their unused diabetic testing strips they receive from Medicare to fraudulent companies who later reissue and rebill them to Medicare. Both emergency and non-emergency transportation can also be categories of fraud. Dishonest ambulance providers may bill for a higher level of service than performed or bill for greater mileage than actually traveled. Fraud in non-emergency transportation can occur when Medicare is billed for uncovered services, such as routine trips to a favorite restaurant or shopping excursions. Fraud in inpatient services may not be as noticeable as outpatient schemes, but it is often more costly, both to the program and sometimes the patient. While it's unusual for a beneficiary to be hospitalized when not medically necessary, it can certainly occur. However, overcharging, misrepresentation of services, and billing for services that were never rendered are more frequent schemes. Hospital billing is complex, and it is often difficult for the patient to know whether their hospital services were properly billed. Hospice care is a much needed and compassionate program for those at the end of life. It is a valuable benefit to patients and families, and yet criminals do not hesitate to take advantage of the vulnerable. For example, a common fraud scheme is to falsely diagnose someone as terminally ill when they are not. You can only imagine the emotional distress in this type of scam. Physicians generally certify patients as being terminally ill when they have a life expectancy of 6 months or less if the disease runs its normal course. While it is always difficult to predict the date of someone's passing, some schemes have involved patients receiving hospice service for years when they did not have a true terminal diagnosis upon enrollment. Sadly, these patients then only receive palliative, known as comfort care, under the hospice program when they could have been receiving curative care. Another scheme is when expensive continuous care, known as by the bedside care, is billed when the hospice worker only provided standard comfort care during a health crisis. And then some unethical companies may provide a kickback to a physician for hospice referrals, or may try to bribe patients into enrolling to receive uncovered services, such as housekeeping. Oncology is the branch of medicine that involves the prevention, diagnosis, and treatment of cancer. While rare, there have been cases where oncologists and other providers have rendered chemotherapy with unapproved medication. Sadly, in one of the most egregious patient harm cases to date, hundreds of patients were falsely diagnosed with cancer in order for the physician to render and bill for expensive chemotherapy. In other matters, Medicare was charged for expensive custom oncology treatment when a lower level of treatment was rendered. A rising area of concern includes surgical fraud. While there are certainly cases involving upcoding and overcharging, a greater concern is medically unnecessary invasive surgery. All medically unnecessary surgery involves the risk of patient harm, whether routine heart stents or complex orthopedic surgery. So be sure to work closely with your trusted provider on any necessary surgery. Mental health, known as behavioral health care, may be covered under Medicare Part A or B, depending on whether the service was rendered in an inpatient or outpatient capacity. Unfortunately, criminals often target vulnerable patients in both categories. For example, group therapy may be billed as more expensive individual therapy. or psychiatrists, psychologists, or other therapists may bill for more therapy time than actually provided. Some corrupt behavioral health providers may misrepresent the type of program completely, such as billing for intensive partial hospitalization services when they were actually provided in a community mental health center setting. Another example is billing for therapy when purely recreational activity was conducted, such as watching a movie for entertainment or doing crafts. In extreme cases, criminal enterprises have been known to pay kickbacks to providers and/or patients for spa vacations billed to Medicare as intensive inpatient therapy programs. Post-hospital care may be provided in a skilled nursing facility for certain patients. In some cases, facilities such as long-term care type of facilities may be billed for or may bill for services not rendered, especially in times of inadequate staffing. However, a more concerning example may be a scheme where hours of unnecessary physical, occupational, or speech therapy were provided to end of life or even comatose patients just to justify higher billing to Medicare. Sadly, there have also been cases of neglect, abuse, and stolen pain medications in long-term care settings. Medicare Advantage is a type of health insurance plan that provides Medicare benefits through a private sector health insurer. Medicare Advantage, administered through Medicare Part C, closely tracks with Part A and B fraud, although the program is set up differently. Whereas original Medicare, Part A and B, are administered by the federal government, private Medicare Advantage plans contract with the federal government to provide coverage for Medicare services. These plans are paid at a set rate for each beneficiary they enroll. Certainly, misrepresented, upcoded, and medically unnecessary services are seen in Medicare Advantage, but private insurers have a strong incentive to ensure their programs are financially viable and are often on the lookout for suspect services. However, insurance companies may be involved in misleading marketing or enrollment fraud. In some schemes, insurance brokers, marketers, and even criminal enterprises may enroll a beneficiary in a plan without their knowledge or misrepresent the services that a plan covers in order to get someone to enroll. They often target vulnerable beneficiaries, such as those with dementia, who may not immediately notice the enrollment switch. Your local SHIP program is a great resource when evaluating whether a Medicare Advantage plan is right for you or a family member. Now let's move on to fraud in Medicare Part D. Medicare Part D is the optional prescription drug benefit, which was implemented to help Medicare beneficiaries pay for self-administered prescription drugs. The broad scope of prescription drugs the program covers is a big target for fraud. Common schemes include prescription drug diversion, drug adulteration, prescription refill schemes, and medically unnecessary prescriptions. Illegal drug diversion is a crime that often makes the headlines, but some are surprised to hear that prescription drug diversion is also a problem. In some cases, those with substance use disorders may actively doctor shop to find a source of the prescription drug they're seeking, usually a controlled pain medication. In other cases, disreputable physicians will overprescribe prescription medications for financial gain, often a kickback from a criminal gang. And in egregious cases, healthcare providers may steal much needed pain medications from patients in the home or even in clinical settings. Another concern is the receipt and sale of prescription medication that was obtained from unapproved sources. Drug adulteration can occur when a pharmacy or manufacturer illegally substitutes ingredients or even different medications in lieu of the advertised prescription. Drug adulteration and questionable supply chain issues can occur in pharmacies, skilled nursing facilities, or even physician offices. In other cases, pharmaceutical companies have paid kickbacks to physicians for off-label prescribing of their medication. A recent trend has been the marketing of specialty and expensive compound drugs, which may contain mislabeled pharmaceutical ingredients or were actually over-the-counter non-prescription creams. In prescription refill schemes, pharmacies may bill for medications never provided by billing for automatic refills or other prescription drugs that were not picked up by the patient. It's important to note that medically unnecessary prescriptions continue to be a problem in Part D. Pharmaceutical companies may pay kickbacks to physicians to write prescriptions for highly reimbursed pharmaceuticals. There are also complex criminal enterprise schemes where patients are paid a kickback to receive and fill a prescription at a corrupt pharmacy. The patients do not actually pick up the drug, and the pharmacy bills for the prescription and keeps it on the shelf where it can later be resold. As you can see, there is a broad spectrum of fraud related to prescription drugs. Now that we've covered the common fraud schemes in Medicare, let's focus on specialty issues and emerging trends. These include unique and emerging types of fraud that target new areas of medicine or events, such as a pandemic. Let's begin with an area of fraud that's seen a significant increase in recent years: medical identity theft. It's hard to read the news and not see a headline about the rising incidence of identity theft. These are often heartbreaking stories about the emotional distress of a stolen identity and drained bank accounts. Identity theft occurs when personal identifiers such as date of birth and social security numbers are stolen by criminals and used illegally. Financial identity theft occurs when criminals compromise bank accounts, credit cards, and other areas involving financial transactions. However, many do not realize that fraudsters have even more incentive to commit medical identity theft. Unlike a credit card that is shut down by fraud analytics in a number of days, medical identities can be sold again and again and can be tremendously profitable to an identity thief. Identity thieves are the modern bank robbers of the Wild West, and leading the charge are robocallers and telemarketers who relentlessly call in the hope of getting unsuspecting individuals to give out their personal information. Robocalls have continued to increase despite numerous programs, regulations, and laws to decrease their prevalence. In fact, in recent years, telemarketers have used technology to bombard beneficiaries with daily pre-recorded calls that are often false and misleading. A common fraud includes a scammer misrepresenting themselves from Medicare in order to obtain the Medicare's beneficiary number or personal information. Genetic testing is a newer diagnostic tool that looks for changes in your DNA. It helps clinicians with experience in genetics to customize the medical care that someone receives. However, because it is a newer and complex technology and requires expertise to interpret the results, it is also highly reimbursed. And this area of medicine turned out to be a bank to be robbed by criminals looking to make a quick profit. Law enforcement and oversight agencies have noted a significant increase in complaints about individuals being targeted by robocallers, health fairs, farmers markets, and even by physicians. These individuals are convinced to receive unnecessary cancer or DNA tests, for which Medicare has billed tens of thousands of dollars. In many cases, beneficiaries received a cheek swab and handed over their Medicare number, only to find that their identity was stolen and no test was actually performed. In some cases, the genetic testing companies tried to convince patients they owed thousands of dollars to them because Medicare did not pay. DME brace scams have been a problem for the last few years. In many cases, Medicare beneficiaries were talked into receiving a back brace or other orthotic they did not need, simply by being asked whether they had low back pain. However, in most cases, the back brace simply showed up in a package on their doorstep, ordered by a physician they had never seen. This is a concerning red flag that someone's identity has been compromised. Has anyone not received a click here link via text or email to resolve an urgent matter? Known as phishing, this technique is a common ploy where the cyber criminal sends a message to trick the receiver into revealing sensitive information or to install malware on their phone, laptop, or other electronic device. Cyber scams are not just limited to credit card fraud or online shopping schemes. Thieves have utilized any number of social engineering techniques to commit healthcare fraud as well. A frequent scam is an email, text, or call purportedly from Medicare to register for a new Medicare card, the only purpose of which is to obtain the beneficiary's Medicare number and date of birth to bill for expensive tests, equipments, and medical services that were never rendered. Although the fax machine is considered dated technology, that doesn't mean it isn't part of a new fraud scheme. In some of the initial complaints, patients were told by their trusted healthcare provider that faxes had been received from a pharmacy in order to order high-grade protective face masks for the patients due to the COVID-19 pandemic. These physicians knew they had not ordered the face masks, but were puzzled by the recognizable name of the pharmacies. Calls to the pharmacies revealed that they had not sent the fax or ordered the items. Other complaints have come in that physicians have received faxes for DME, such as back braces, or an unsolicited request to provide medical notes for the patient. These are most likely variations of medical identity theft scams, so be sure to report it to your trusted physician, especially if they mention an unsolicited fax has arrived in your name. Now let's discuss criminal enterprises. You may have heard the term criminal enterprises and organized crime and wondered about the difference. While the two terms are often used interchangeably, there are specific definitions for the two groups. Criminal enterprises are often more loosely based, and their criminal activity may be limited to specific geographic areas. Organized crime, often referred to as transnational organized crime, are more structured and may operate in syndicates on an international basis. Organized crime schemes in healthcare are often known as 110% fraud. This is because their sole purpose, 100%, is to commit fraud and make a profit. However, the extra 10% comes from the other criminals they must cooperate with to facilitate their scams. These include identity thieves, money launderers, and even once legitimate clinicians who have compromised their career to put profit over patient. With the plethora of profitable fraud schemes available to criminals, why healthcare? While no one knows the real reason, many believe it is because healthcare fraud is safer, more profitable, and may result in less jail time than other types of crime. Regardless of the reason, healthcare fraud is committed by a variety of individuals, from standalone fraudsters to international organized crime syndicates. While we discussed a variety of prescription drug screening schemes under the Medicare Part D section, it's important to note that prescription drug diversion may also include international drug trafficking organizations and large criminal syndicates. In learning more about criminal enterprises and organized crime, it's important to understand the difference between false fronts and storefronts. False fronts are fictitious addresses or businesses that don't physically exist, at least not anywhere other than paper or the internet. A false front operation may also be listed under a straw owner to hide the real identity of the criminal or crime group that runs it. A storefront, in the context of crime, is an actual building or business that exists to further the scam. It may look like a legitimate DME company, but look closely, and the wheelchair in the window and the part-time receptionist may be only for the purpose of making an empty warehouse look legitimate. And finally, the increasing role of cyber scams can't be emphasized enough when discussing the role of criminal enterprises and organized crime in healthcare. As our world becomes more technologically advanced, so do the criminals. And in many ways, the advancement in technology facilitates healthcare fraud that otherwise would have been more difficult to commit in a face-to-face scenario. As an example of the seriousness of criminal involvement in healthcare matters, Interpol issued an alert in December of 2020 that organized crime networks were targeting COVID-19 vaccines, both physically and online. The International Criminal Police Organization, known as Interpol, is an international organization that facilitates worldwide police cooperation and crime control, and was concerned enough to issue an attention-getting bulletin that warned of a fraud scheme that could easily result in patient harm due to the manufacturing, distribution, and sale of illegal and possibly ineffective vaccines, in addition to other pandemic-related crime. Now let's discuss methods of contact. It's important to know these methods that criminals use to facilitate their scams. One of the most common methods of contact is by telephone. As previously discussed, robocallers and telemarketers are relentless in attempting to contact Medicare beneficiaries, seniors, and anyone they believe they can scam for the purpose of obtaining identity, financial, and medical information. Criminals also use the internet, email, and social media to facilitate a number of online scams. Of great concern is that scam artists also go door to door or personally visit group homes or other settings where seniors reside. This represents a big risk to seniors who may reside alone or are particularly vulnerable due to dementia and or hearing loss. And whether it's a pamphlet placed on the doorstep or a notice on a community bulletin board, criminals also use mail and print and all methods of contact to target Medicare beneficiaries. In addition to the specialty areas of fraud just discussed, it's critical to stay on top of the latest fraud trends. Criminals are opportunistic fraudsters, and whether it's a pandemic, natural disaster, new technology, or even a change in regulations, they'll go down every rabbit hole hoping to find a winner of a scam. Here are a few schemes that are emerging trends. Sadly, the COVID-19 pandemic has been a perfect opportunity for criminals to target vulnerable Medicare beneficiaries, often at home. Scams have included those related to COVID-19 treatments, testing, and cures, such as COVID curing toothpaste. There have been fraud schemes involving supplies such as masks and hand sanitizer, and even those related to services such as home health and hospice. Aggressive health insurance marketing has also been on the rise, with misleading claims that only their insurance product will cover COVID-19 care. Current vaccine scams include robocalls to schedule Medicare beneficiaries for the vaccine in a not-so-obvious attempt to obtain their Medicare number. Complaints have also been received about vaccine surveys. In fact, some lucky beneficiaries win a free iPad Pro at the end of the survey and are lured into entering their credit card information to pay a mere $9.99 in shipping, only to have their financial information compromised. While the large majorities of providers are honest and ethical individuals working tirelessly on the front lines of healthcare, a small percentage put profit over patient. An increasing area of fraud is the broad scope of add-on services, from medically unnecessary genetic tests ordered by a physician who receives a kickback for each test, to a chiropractor who orders multiple orthotics for every single patient. The add-on services add up for Medicare and the beneficiary. Be sure to work with your trusted provider regarding needed medical services and not simply respond to a flashy advertisement or an unsolicited call. As we begin to wrap up our tour of the wide world of Medicare fraud, it's important to mention telehealth. The terms telehealth and telemedicine are often used interchangeably, but regardless of the term, telemedicine is a critical service method and certainly a vital mode of service during the pandemic. However, the fraudsters have taken note, and in true opportunistic style, they've used the good field of telemedicine in bad ways. Fraud schemes related to telehealth include upcoding, misrepresentation, billing for services never rendered, false credentials, and even identity theft. The old adage, an ounce of prevention is worth a pound of cure, applies to healthcare fraud as well as to your own personal healthcare. You've now learned how to detect a variety of fraud schemes, which will help you prevent Medicare scammers from taking advantage of yourself, friends, or family in the future. Let's end our presentation with information on how to report Medicare fraud. As we previously discussed, billions of federal dollars are lost annually due to healthcare fraud and errors and abuse. The Administration for Community Living manages the grants for both the SHIP and SMP, known as Senior Medicare Patrol programs. The mission of the Senior Medicare Patrol, or SMP, is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report suspected healthcare fraud, errors, and abuse through outreach, counseling, and education. The SMPs work to resolve beneficiary complaints of potential healthcare fraud in collaboration with state and federal partners. Some of these partners include the U.S. Department of Health and Human Services, Office of Inspector General, the Centers for Medicare and Medicaid Services, state Medicaid fraud control units, and state attorneys general. The SMPs recruit and train retired professionals and other volunteers to recognize and report instances or patterns of healthcare fraud. You can stay up to date on fraud schemes, find contact information for your state SMP program, or report Medicare fraud at www.smpresource.org. You can also send an email to info@smpresource.org or call the national toll-free number at 1-877-808-2468. This concludes our presentation on Medicare Fraud 101. In addition to learning about national healthcare fraud schemes that affect Medicare, you also learned how to prevent, detect, and report Medicare fraud. Thank you for your attention about this important topic, and remember that the SHIP programs offer local Medicare help, including trusted, unbiased, and one-on-one counseling and assistance. For more information about the SHIP programs in your state, use the SHIP locator at www.shiphelp.org or call 1-877-839-2675. Thank you.